Lung cancer affects millions of people worldwide, and while treatments have made great strides, it's still the deadliest and least funded type of the major cancers. Despite this, there is still hope. Joining us now to discuss the power of biomarker testing and targeted therapies is Dr. Tejas Patil from the University of Colorado Anschutz, along with Janet Freeman-Daly, a patient living with ROS1-positive lung cancer. Good morning to you both.
Good morning.
Good morning.
So I wonder if you can tell me, why is research into treatment so important for non-small cell lung cancer patients who have a ROS1 tumor?
That's a great question. And I think to answer that question, I want to give a little bit of history. In the 90s, when we were thinking about treating lung cancer, the way we would do it was very simple. You look under a microscope, you have lung cancer, and you get chemotherapy. What we've learned in the last 20 years is the importance of biomarkers. Biomarkers really take advantage of the genetic makeup of cancers and can offer patients newer therapies that are targeted treatments that oftentimes come in a pill that patients can take once a day. So in Janet's case, she's on a pill that she's taking once a day, and it's really improving her quality of life.
It's true.
Yeah, okay, so ROS1 positive cancer has an identified biomarker. Why is it important for every lung cancer patient to ask, what is my biomarker?
It's very important for patients to ask what their biomarker is, because biomarker testing allows patients the opportunity to get personalized treatment. Not every patient needs to get chemotherapy. Some patients, especially if you know what your biomarker is, can skip chemotherapy altogether and receive targeted therapies that really allow patients to live longer with a better quality of life.
Janet, if you wouldn't mind, would you be able to share with us your story and also how you found out that you were ROS1 positive?
Certainly. So I was diagnosed in 2011 with lung cancer, and that was before biomarker testing was generally available. So I had radiation and chemotherapy twice, and both times, as soon as I stopped treatment, the cancer grew. I was told that I would be on chemotherapy the rest of my life, which would probably be short. However, in online patient groups, I learned about biomarker testing and clinical trials. And so I got tested and found that my tumor was ROS1 positive, that I was eligible for a clinical trial in which I would take a pill for which the side effects generally were more tolerable. I joined that trial. I have now been on that pill and doing well for over 11 years.
That's incredible. I mean, I was about to ask you what the difference was in knowing what your biomarker made to your treatment, but you've just expressed it there in the best way possible, that the treatment was selected for you, tailored for you, and now you're clearly, doing so much better under that. Doctor, can you please explain why it's important for lung cancer patients to consider clinical trials as part of their treatment and how they can participate in them?
Absolutely. Lung cancer is a very dynamic field, and there's a lot of new treatments that are coming down the pipeline. Clinical trials allow patients to get access to those newest treatments. And in Janet's case, it was really a clinical trial that got the pill that she's taking that's allowed her to live as long as she has so far. And I would encourage every patient with lung cancer to at least ask the question, am I a candidate for clinical trials?
And if the patient is concerned that they might get a placebo or not get good treatment, it's important to know that clinical trials, at a minimum, give you the best possible treatment for your lung cancer and also allow you to take advantage of the science.
Thank you guys for joining us this morning. Janet, it's wonderful to see how well you're doing. Thank you, Doctor, for your time as well. And for more information, everyone out there, please visit lcfamerica.org.